Indoxyl sulfate, potassium salt, is a chemical compound that belongs to the class of organic compounds, known as indoles. It is the potassium salt of indoxyl sulfate, which is a metabolite of tryptophan, an essential amino acid. Indoxyl sulfate is produced in the liver and then excreted by the kidneys into the urine. Indoxyl sulfate has been studied for its potential role in the development and progression of chronic kidney disease, CKD, and cardiovascular disease. High levels of indoxyl sulfate in the body have been associated with increased inflammation, oxidative stress, and endothelial dysfunction, which are all factors that contribute to the progression of CKD and cardiovascular disease. Indoxyl sulfate, potassium salt, has also been studied for its potential role in the gut-kidney axis, as it is produced by gut bacteria and then absorbed into the bloodstream. It has been suggested that the gut microbiota may play a role in the production of indoxyl sulfate, and that targeting the gut microbiota may be a potential therapeutic approach for reducing indoxyl sulfate levels in the body. In addition, indoxyl sulfate potassium salt has been investigated as a potential biomarker for CKD and cardiovascular disease, as high levels of indoxyl sulfate have been associated with an increased risk of mortality and adverse cardiovascular events in patients with CKD. Overall, indoxyl sulfate potassium salt is a compound that has been studied for its potential role in the pathogenesis of CKD and cardiovascular disease, as well as its potential use as a biomarker for these conditions. Further research is needed to fully understand the mechanisms of action of indoxyl sulfate and its potential as a therapeutic target for these diseases.